Another concept to look at is potency. Potency refers to the strength of the drug. And this is one of the most important considerations when you look at as far as both safe and effective dosing, because obviously the drug strength is going to significantly impact how much of an individual drug somebody's going to take in order to get a response. Remember that we want the lowest dose possible capable of producing a response based on the threshold, which we had talked about earlier. So what you see is the more potent the drug, the smaller the dose of the individual drug. Now, this doesn't mean that it's a better drug, it just means that it's a stronger drug. And at the bottom of this, I have three examples. You have aspirin, which you look at a normal dose being 650 milligrams. You have ibuprofen, which is 400 milligrams, and then you have ketoprofen, which is 12.5. So the most potent of these drugs, which are all anti-inflammatory medications, would be the ketoprofen because the dosing of the ketoprofen is smaller. Now, as we know, when you take a drug, drugs don't just start acting right away. Some drugs do take a little longer to respond, some respond much faster. This is known as the time response of the individual drug. Now, there's a lot of different things that affect this. Something that is going to affect it are the metabolic processes. In other words, as the drug circulates through the body, how the metabolic processes of the body kind of allow the drug to react. And there's other factors that will play into this as well. We'll talk about some of the metabolic processes later. The time response is really based on three main factors. The first factor, latency, that is referred to the onset of action that indicates the time required for a drug to produce the response after it is administered. You have the maximal effect, which is the length it takes for the drug to reach its peak efficacy. And then you have your duration of action, which is the period of time that the drug produces a response after a single dose. So those are the three factors that take into consideration when you look at the time response. And there's another example on figure 2.3 on page 20 in your text. There's a typical time response curve that you can see and refer to that. There's also, when you look at these three factors, the latency, the maximal effect, and the duration of action, there are four concepts that affect those three factors. What I want you to do is in your text, look up those four concepts and write those in your notes. So look at that on page 20 on your text. So we looked at potency and, again, looking at what's required to achieve an effect of a drug. The issue that you have with that is it doesn't do anything as far as determining the safety of the dosing. And that's obviously a big concern that we want to make sure that we kind of address when we're looking at this. So the therapeutic index is the range in which effects are produced. And what we do is when we kind of look at this is we're looking for desirable responses without adverse effects. So in other words, we're looking to get the effect of the drugs, meanwhile limiting some of the adverse effects that come along with drugs. And what we look to do in determining the therapeutic index is we use a ratio of what's known as the median effective dose and what's known as the toxic dose. So the ED50 and the TD50. What those are, the median effective dose is the dose required to produce a response in 50% of the test subjects. So as people are going through testing, whatever produces a response in 50% of the test subjects, that's known as the median effective dose. The toxic dose is the portion of the population in which 50% of the individuals exhibit adverse effects. So what we do is we look for a ratio between the two, and that's what's deemed clinically relevant. In order to be considered clinically relevant, the therapeutic index should be greater than 1 to 1. meaning that the ratio of the median effective dose to the toxic dose should be better than 1 to 1. Higher numbers look at producing safer effects or what we would consider less toxic drugs. So the therapeutic index looks at what's going to be effective while at the same time also being safe for the people taking it. The plasma dose response looks at the response of a dose of a drug at the site of action, correlate it with the plasma or serum level of that drug. So it starts to look at how the drug starts to kind of build up in the circulation. There are some different things to consider again when you're looking at this. You have what's known as the minimal effective concentration. So that period is going to be when you're looking at when the dose is first administered. That's when it could first be detected in the plasma, but it might not have high enough concentrations to produce an actual response. So that's your minimal effective concentration. Your duration of action is the length of time the drug concentration remains above the minimal effective action concentration. So once the drug reaches that point, that's considered the duration of action. And then the minimum toxic concentration is the point at which the toxic range is reached, as far as when the drug will start to produce toxic effects. So we have in figure 2.5 in your text a plasma response curve looking at the plasma these different plasma concentrations. Again, very effective and as far as being able to determine what's going to be safe for the patients, and we start to consider dosings and kind of how the drug affects the body. So another discussion point question, what you'd get with this is what's known as a therapeutic window. In determining this, what's the significance of drugs that have a narrow therapeutic window? So take a look at that and respond in the discussion portion as far as what that actually means and what's the significance of that.